Hello friends, let us see the bone humerus. So it is a bone of the upper limb present into the arm, and with the scapula it forms the shoulder joint, which is the most unstable joint because of the glenoid cavity of the scapula is smaller than the head of the humerus, and here it will be formed the elbow joint along with the radius and the ulna. Now let us see the features. As you know, it is a long bone, it having the two ends. This is the upper end and this one is the lower end. The upper end consists of the spherical head, and the lower end is expanded from side to side, and it is flattened from anterior to posterior side. So this is the upper end and this is the lower end of the humerus. Now let us see the features. In the upper end, here you can see this is the spherical rounded head, and it is its surface is smooth, which is known as the articular surface, and articulates with the glenoid cavity of the scapula. Just next to it you can see this is the neck of the humerus, and this is the anatomical neck of the humerus, which separates the head from the rest of the shaft. It consists of three neck. This one is the anatomical neck. Now you can see this constriction. This is the surgical neck of the humerus, which divides the upper end from the shaft. Here this is known as the surgical neck of the humerus. Why it is known as the surgical neck? Because it is related with the axillary nerve, and the fracture at this region may lead to the nerve damage. So this is known as the surgical neck, and around 0.5 centimeter above the surgical neck there will be the morphological neck, and the line of epiphysis passes from this morphological neck. So this is its clinical importance. So head, then anatomical neck, surgical neck, and the morphological neck. The other features are it consists of two tubercles. This one is the small elevated portion. This is known as the lesser tubercle, and just next to it this one is the greater tubercle. In between the lesser and greater tubercle there is a one groove which is known as the intertubercular sulcus. So this is the intertubercular sulcus. This groove is known as the intertubercular sulcus. Now here at the greater tubercle there are three impressions are there. This one is the upper impression, this one is the middle impression, and this one is the inferior impression. So three impressions are there on the greater tubercle. Next move towards the lower end. So in the lower end you can see it consists of two epicondyles, this and this. These are two epicondyles. The medial epicondyle is more prominent than the lateral epicondyle. So this one is the medial epicondyle and this one is the lateral epicondyle. Just above the epicondyles, these are the supracondylar ridge. This one is the medial supracondylar ridge, and this one is the lateral supracondylar ridge. And at the lower part there are two articular surfaces are there. This one, the pulley shaped articular surface, it is known as the trochlea, whereas the head like rounded articular surface is known as the capitulum. And the median flank of the trochlea is around 0.5 centimeter, lower than the lateral flank, and because of this medial flank which is lower than the lateral, the carrying angle is formed, and just above the trochlea there is a one fossa which is known as the coronoid fossa. Just above the capitulum there is one fossa is there which is known as the radial fossa. Okay, just above the capitulum there is one fossa which is known as the radial fossa. Just above the trochlea this fossa known as the coronoid fossa, and on the posterior side the one larger fossa is there which is known as the olecranon fossa. So three fossa is there: olecranon, coronoid, and the radial fossa. Now let us see the shaft. Shaft having three border and three surfaces. The border which begins from the lateral lip of the intertubercular sulcus passes downward anteriorly towards the radial and olecranon fossa. This is known as the anterior border. The border which begins from the medial lip of the this one intertubercular sulcus, and it passes and continue as a medial supracondylar ridge. This border is the medial border, and the border which is not markedly defined, and it is interrupted, rounded. This border, this is known as the lateral border of the humerus. This is at the below it continues as a lateral supracondylar ridge. Okay. And surfaces, it having three surfaces. This one is the anteromedial surface between the anterior and medial border, anteromedial surface between the anterior and lateral border. This is the anterolateral surface, and between the medial and lateral border, this is the posterior surface. Now on the posterior surface, there is at the middle of the shaft, there is one tuberosity is seen, V-shaped tuberosity, which is known as the deltoid tuberosity. So this is the deltoid tuberosity, here we can see, and just below the deltoid tuberosity there is one groove is there. This is known as the radial groove, which passes downward and laterally. So this is the radial groove, and on the posterior surface upper part there is a one vertical ridge is present, which gives attachment to one of the muscle of the back of the arm. So this is about the features. Let us see the anatomical position, and so this is about the features of the humerus, and let us see now determine the side of the humerus. So to determine the side of the humerus, the head should be on the medial side, head directed medially little bit forward and upward. The lower end, which having a more prominent epicondyle, it should be directed on the medial side. This should be on the medial side, and the olecranon fossa, this one, it should be on the posterior side. So you should keep this on the posterior side, olecranon fossa, head directed medially, and this one, the medial epicondyle, should be on the medial side. So this one is of the left side of the humerus. Now let us see the attachments on the humerus. Okay, now let us see the attachments. First on the upper end, just remember upper end gives receives the insertion, and the lower end gives the origin. So upper end having insertions, lower end having receives the or gives the origin to the muscles. First first insertion at the lesser tubercle, here at this point, lesser tubercle. This lesser tubercle, it receives the insertion of the subscapularis muscle. Here there will be the subscapularis. Then on the greater tubercle, at the upper impression, here there will be the supraspinatus muscle. On the posterior side, middle impression, here there will be the insertion of infraspinatus muscle, and at the lower impression, here there is the insertion of teres minor. So subscapularis, supraspinatus, infraspinatus, and teres minor. These four muscles, it forms the rotator cuff around the shoulder joint. Now let us see the intertubercular. Let us focus on the intertubercular sulcus. On the medial lip of intertubercular sulcus towards the head, there is a insertion of teres major muscle. On the lateral lip, here there is an insertion of pectoralis major muscle, and into the intertubercular sulcus, floor of the intertubercular sulcus, there is a insertion of latissimus dorsi muscle. So mnemonic for this intertubercular sulcus is a lady between two major, latissimus dorsi between the teres major and pectoralis major muscle. Now the structure passing through this groove. The structure passing through the intertubercular sulcus or bicipital groove is one is the tendon of um, long head of the bicep muscle and the ascending branch of the anterior circumflex humeral artery. This two structure passes from the intertubercular sulcus and it is covered or breached by the transverse ligament of the shoulder joint. So this is about the intertubercular sulcus. Another features or another attachment is the capsule of the shoulder joint. It attaches at the anatomical neck except at the lower part where this capsule is extend little bit below towards the from the anatomical neck. So here there will be the capsule of the shoulder joint. Now let us move on the lower part. Here at the middle of the shaft there is a deltoid tuberosity. So deltoid tuberosity, V-shaped tuberosity, it receives the insertion of deltoid muscle. So deltoid tuberosity, it receives the insertion of deltoid muscle. Then the groove below the deltoid tuberosity, here the groove below the deltoid tuberosity, it passes the structure. This groove is known as the radial groove or the spiral groove and it passes the radial nerve. So radial nerve passes from here. Then on the shaft, attachments on the shaft and lower hand. So attachment on the shaft at the lower two-third portion, intermedial and anterolateral surface, this entire area, it gives origin to to brachialis muscle. So lower end having origins. Then on the medial supracondylar ridge, on the medial side, there will be the pronator teres here, and on the medial epicondyle there are the common flexures arises, common flexure origin from here and pronator teres from here. On the lateral side, anteriorly, lateral epicondyle, here there is a common extensors origin here. From here the common extensors arises, and on the lateral supracondylar ridge, upper two-third portion, there is origin of the brachioradialis muscle. Here there will be the upper two-third part, lateral supracondylar end, brachioradialis, and at the lower part, just below it, here, extensor carpi radialis longus muscle. Extensor carpi radialis longus arises from the lower part. The posterior side, on the posterior side, we have already seen at the deltoid tuberosity there are the insertion of the deltoid muscle. There is insertion of the deltoid muscle, and on the posterior side, one vertical ridge is there here. From here there is the origin of head of the triceps, and the area, posterior surface area below the deltoid tuberosity and the spiral groove, here there will be the origin of medial head of the triceps, and you already know the long head arises from the infraglenoid tubercle. Then so lateral head and the medial head of the triceps from the posterior surface. Now just behind the lateral epicondyle, here this area, it gives origin to the anconeus muscle. So here there will be the anconeus muscle arises. Now at the lower end the capsular ligament, attachment of the capsular ligament of the elbow joint. The capsular ligament of the elbow joint, it includes all the articular surfaces and also all the fossa, but not the epicondyles. So the margins of attachment of the capsule of the elbow joint, it passes just above the trochlea, then above the coronoid fossa, then above the radial fossa and capitulum on the anterior side. And on the posterior side, it passes on the posterior aspect of the trochlea, and it also covers the olecranon fossa. So this is how the capsule of the elbow joint attaches. Now, most commonly asked question, one is the nerve related with the humerus. There are three nerve related with the humerus. One is around the surgical neck here. There will be the axillary nerve. Next is here, and in the radial groove there will be the radial nerve, and just behind the medial epicondyle here there will be the ulnar nerve. So three nerves are related with the humerus: axillary around the surgical neck, radial nerve within the radial groove, and the ulnar nerve just behind the medial epicondyle. This bone is also known as the funny bone, because any compression just behind the medial epicondyle of the humerus, it gives the tingling sensation around the elbow joint, and because of that this bone is also known as the funny bone. The another most frequently asked question is intertubercular sulcus. The structure passing from the intertubercular sulcus are the long head of the biceps and ascending branch of anterior circumflex humeral artery. So these are frequently asked question about the humerus. So this is all about the humerus. If you like my video, please subscribe my channel. Also share. Thank you.